What is the primary purpose of the Florida TLSAE course? A. To teach safe driving skills. B. To educate about the effects of alcohol and drugs on driving. C. To provide legal knowledge about traffic laws. D. To prepare for the driving skills test. Answer B. The TLSAE course focuses on educating drivers about how alcohol and drugs can impair driving abilities. Which organ is primarily responsible for metabolizing alcohol in the body? A. Heart. B. Lungs. C. Kidneys. D. Liver. Answer D. The liver metabolizes most of the alcohol consumed, converting it into less harmful substances. Which of the following is a short-term effect of alcohol on the body? A. Liver disease. B. Increased heart rate. C. Improved reflexes. D. Enhanced concentration. Answer B. Short-term effects of alcohol can include increased heart rate, reduced coordination, and impaired judgment. Which type of drug is known for causing hallucinations? A. Depressants. B. Stimulants. C. Hallucinogens. D. Opiates. Answer C. Hallucinogens are drugs that alter perception and can cause visual and auditory hallucinations. What is the synergistic effect in terms of drug use? A. The reduction of drug effects when combined. B. The increased effect when drugs are mixed. C. No effect when drugs are used together. D. A predictable response to drug use. Answer B. The synergistic effect refers to the amplified effects of combining two or more substances, often leading to greater impairment. Which drink contains approximately the same amount of alcohol as a standard beer? A. A shot of vodka. B. A glass of wine. C. A large mug of beer. D. A pint of cider. Answer A. A standard drink is typically 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of distilled spirits like vodka. Which physiological aspect is not directly influenced by substance abuse? A. Heart rate. B. Memory retention. C. Hair growth. D. Reaction time. Answer C. Substance abuse can affect heart rate, memory, and reaction time, but it does not directly influence hair growth. How does alcohol act as a gateway drug? A. It leads directly to the use of illegal drugs. B. It lowers inhibitions and increases the likelihood of trying other substances. C. It has no relation to other drug use. D. It only leads to the use of tobacco. Answer B. Alcohol can lower inhibitions, making individuals more likely to experiment with other drugs. What is a common psychological effect of addiction? A. Increased physical strength. B. Enhanced cognitive abilities. C. Compulsive drug seeking and use. D. Better decision-making skills. Answer C. Addiction is characterized by compulsive drug seeking and use, despite harmful consequences. Which of the following is considered a cost of addiction? A. Improved social relationships. B. Increased financial stability. C. Loss of employment. D. Enhanced physical health. Answer C. Addiction often leads to significant personal, social, and economic costs, including loss of employment. What is a potential societal cost of alcohol abuse? A. Reduced medical expenses. B. Increased road safety. C. Lower insurance premiums. D. Higher healthcare costs. Answer D. Alcohol abuse contributes to increased healthcare costs, accidents, and lost productivity. How can impaired driving affect others on the road? A. It has no impact on others. B. It can increase the risk of accidents for sober drivers. C. It makes roads safer for pedestrians. D. It only affects the impaired driver. Answer B. Impaired drivers pose a danger to everyone on the road, increasing the risk of accidents. What is a common strategy to prevent drinking and driving? A. Encouraging moderate drinking. B. Implementing harsher penalties for drunk driving. C. Allowing drunk drivers to drive at lower speeds. D. Encouraging the use of public transportation. Answer D. Encouraging alternatives to driving, such as public transportation, helps reduce the incidence of drunk driving. At what blood alcohol concentration, BAC, does impairment begin? A. 0.01%. B. 0.05%. C. 0.08%. D. 0.1%. Answer A. Even a small amount of alcohol can impair driving abilities, with noticeable impairment typically beginning at a BAC of 0.01%. Which category of drugs can impair vision and coordination? A. Depressants. B. Stimulants. C. Hallucinogens. D. All of the above. Answer D. Depressants, stimulants, and hallucinogens can all impair vision and coordination, affecting driving ability. What is the most effective way to avoid impaired driving? A. Eating a large meal before drinking. B. Drinking only water before driving. C. Not consuming alcohol or drugs before driving. D. Taking a nap before driving. Answer C. The best way to avoid impaired driving is to abstain from consuming alcohol or drugs before getting behind the wheel. What is the legal BAC limit for drivers over 21 in Florida? A. 0.02%. B. 0.05%. C. 0.08%. D. 0.1%. Answer C. In Florida, the legal BAC limit for drivers over 21 is 0.08%. Which law in Florida addresses underage drinking and driving? A. Zero tolerance law. B. Graduated licensing law. C. Implied consent law. D. Open container law. Answer A. Florida's zero-tolerance law makes it illegal for drivers under 21 to have a BAC of 0.02% or higher. What does the implied consent law in Florida require from drivers? A. The right to refuse a sobriety test. B. The obligation to submit to chemical testing if suspected of DUI. C. The ability to drive without a license. D. The requirement to carry a minimum amount of cash. Answer B. Under the implied consent law, drivers in Florida agree to submit to chemical testing if lawfully stopped for suspected DUI. Which is not a basic driving law in Florida? A. Wearing a seatbelt. B. Driving on the left side of the road. C. Stopping at a red light. D. Obeying speed limits. Answer B. In Florida, as in the rest of the United States, driving is on the right side of the road. What is the purpose of the graduated licensing law? A. To restrict driving to those over 21. B. To gradually increase driving privileges for new drivers. C. To eliminate the need for driving tests. D. to allow driving without insurance? Answer B. The graduated licensing law allows new drivers to gain experience and skills under less risky conditions. Which of the following is required under Florida's safety equipment laws? A. A fire extinguisher in every vehicle. B. Functioning headlights and taillights. C. A first aid kit. D. A car alarm. Answer B. Florida law requires vehicles to have functioning headlights, taillights, and other safety equipment. What is a common long-term effect of alcohol abuse? A. Improved athletic performance. B. Enhanced cognitive abilities. C. Liver disease. D. Better vision. Answer C. Long-term alcohol abuse can lead to serious health conditions, including liver disease. Which factor is most likely to impair a driver's ability to operate a vehicle safely? A. Listening to music. B. Being well rested. C. Consuming alcohol. D. Driving during daylight. Answer C. Alcohol impairs judgment, coordination, and reaction time, making it unsafe to drive. What should a driver do if they feel impaired but need to travel? A. Drive slowly. B. Call a taxi or use a rideshare service. C. Drink coffee to sober up. D. Drive with the windows down. Answer B. The safest option is to avoid driving altogether and use alternative transportation if impaired. Why are warning labels on alcohol and drugs important? A. They make the packaging look official. B. They provide information about the product's price. C. They inform users about potential health risks and side effects. D. They encourage the use of the product. Answer C. Warning labels help consumers understand the risks associated with using alcohol and drugs. How does stress influence a person's likelihood of substance abuse? A. It increases the likelihood. B. It has no effect. C. It decreases the likelihood. D. It makes the individual immune to addiction. Answer A. Stress can lead individuals to use substances as a coping mechanism, increasing the risk of abuse and addiction. What is the impact of emotional distress on driving? A. It has no impact. B. It improves focus and concentration. C. It can impair judgment and reaction time. D. It enhances driving skills. Answer C. Emotional distress can negatively affect a driver's ability to concentrate and react appropriately. Why is it important to understand the equivalency of alcoholic drinks? A. To choose the cheapest option. B. To know how much alcohol one is consuming. C. To mix drinks for stronger effects. D. To reduce the cost of a party. Answer B. Understanding drink equivalency helps individuals monitor their alcohol intake and avoid overconsumption. Which of the following is an effect of mixing alcohol with medications? A. Reduced medication effectiveness. B. Enhanced driving ability. C. Increased risk of adverse effects. D. No effect on the body. Answer C. Mixing alcohol with medications can lead to serious health risks, including heightened side effects and reduced effectiveness of the medication.